So we're going to do something a little different with this one. Instead of just saying garlic is good for your heart and leaving it at that, which is what 90% of health videos do, we're going to walk through what actually happens inside the body when somebody over 60 starts eating garlic every single day, week by week, almost like a diary, because the changes don't all happen at once. And knowing what to expect at each stage is honestly the difference between somebody sticking with it and somebody giving up on day 4, because they don't feel any different and their breath smells like an Italian restaurant. We spent a really long time on the research for this one. Over 100 clinical trials exist on garlic and cardiovascular health, not blog posts, not somebody's Instagram opinion. Actual randomized, double-blind, placebo-controlled studies, which, if you're not familiar with that phrase, it basically means the gold standard in medical research. The kind of studies where neither the patients nor the doctors know who's getting the real thing and who's getting the placebo. And when you line up all those results in chronological order, week 1, week 2, month 1, month 2, month 3, a really clear picture emerges. That picture is what this video is, a timeline. What garlic is doing to an aging heart, mapped out in weeks. Let's get into it. But first, and we almost put this at the end, but decided it's too important to bury, not all garlic is the same when it comes to heart benefits. And getting this part wrong basically makes the whole thing pointless. The compound that does most of the cardiovascular heavy lifting is called allicin. And here's the thing about Allicin that most people don't know. It doesn't actually exist inside a whole garlic clove, not until you break the clove open. When a clove is crushed or finely chopped, an enzyme called alliinase is released and it converts a precursor compound into allicin. That chemical reaction, which takes about 10 minutes to fully complete, is what creates that intense, sharp, eye-watering garlic smell. Why does this matter? Because it means the way garlic is prepared completely determines whether it works or not. If somebody swallows a whole garlic clove like a vitamin pill, which we've actually seen recommended on some wellness blogs, they're getting almost zero allicin. The clove passes through the stomach intact, the enzyme never gets activated, and the whole exercise was pointless. Expensive breath mints for nothing. If somebody chops garlic and immediately throws it into a screaming hot pan, which is what most people do when cooking, the heat destroys the alliinase enzyme before it has time to convert everything into allicin. The garlic tastes great. It does very little for the heart. The method that the research supports is this: crush or finely chop the garlic. Then wait. Set it on the cutting board for about 10 minutes. Go do something else. Let the allicin fully form. After that 10-minute window, the beneficial compounds are stable enough that they'll largely survive cooking, digestion, and absorption. 10 minutes. That's the magic number, and almost nobody knows about it. The amount most studies used was 1 to 2 cloves per day. Sometimes 3. Not a ridiculous amount. That's what you put in a normal pasta sauce, a salad dressing, a stir-fry. We're not talking about eating a whole bulb raw while staring into the mirror. Just a couple cloves, crushed, rested, and added to whatever was already being made for dinner. All right. Now the timeline. Week 1, days 1 through 7. Let's be honest up front. Nothing dramatic happens in week 1 that anybody would notice, and we think it's really important to say that clearly because a lot of people start things with unrealistic expectations, feel nothing after 3 days, and quit. But inside the body, something is happening, and it's happening in the blood itself. Within the first few days of daily garlic consumption, Allicin and its breakdown products, things like ajoine and diallyl sulfides, which are even harder to spell than they are to pronounce, begin interacting with platelets. Platelets are those tiny cell fragments in the blood whose job is to clump together and form clots when there's a wound. In a healthy person, platelets are lifesavers. You cut your finger, they rush to the scene, stick together, plug the hole. Great. But in older adults, especially those with some degree of atherosclerosis, which honestly includes the majority of people over 60 whether they know it or not, platelets can become what doctors call hyperaggregable. Too sticky. They clump together too easily even when there's no wound to plug. And when a clump of overly sticky platelets forms inside an artery that's already narrowed by plaque, that's a heart attack or a stroke, depending on which artery gets blocked. Research shows that garlic starts reducing this excessive stickiness within the first week. One clinical study found measurable decreases in platelet aggregation within just a few days of daily consumption. Not dramatic decreases. The platelets don't stop working. They're still there to stop a cut from bleeding. They just become a little less eager to clump together inside arteries where they have no business clumping. Nobody's going to feel this happening. There's no physical sensation associated with slightly less sticky blood. But if somebody could look at a blood sample under a microscope on day 1 versus day 7, the difference would be visible to a trained eye. We like to think of week 1 as the quiet week, the foundation week. The blood is getting a little smoother, a little more fluid, a little less likely to do something catastrophic on a random Tuesday morning. It's not exciting, but it's real. Weeks 2 and 3 are days 8 through 21. Okay, this is where people start actually noticing things. And the big one is blood pressure. Multiple meta-analyses, meaning compilations of dozens of individual clinical trials, which is about as strong as scientific evidence gets, have found that daily garlic consumption reduces systolic blood pressure by 7 to 16 millimeters of mercury and diastolic by about 5 to 9. Let us put that in context because those numbers don't mean much on their own. A reduction of 10 to 12 points in systolic blood pressure is roughly equivalent to what a low-dose prescription blood pressure medication would produce. From food. From a couple of cloves of garlic a day. Honestly, that's remarkable. We were surprised when we first saw those numbers and had to go back and double-check the sources. How does it work? The mechanism involves 2 molecules that most people have never heard of, hydrogen sulfide and nitric oxide. Both of these are produced in the blood vessel walls in response to garlic's sulfur compounds. And both of them act as vasodilators, meaning they relax the smooth muscle in artery walls, causing the vessels to widen slightly. Wider vessels equals less resistance. Less resistance equals lower pressure. It's plumbing. Really elegant biological plumbing, but plumbing nonetheless. One early clinical study, and this is the one that kind of blew our minds, looked at 100 hypertensive patients and found that 40% of them showed a drop of 20 or more points in systolic blood pressure within the first 1 to 2 weeks of daily garlic treatment. 20 points. To put that in perspective, that's the difference between a doctor saying, "We need to start you on medication," and a doctor saying, "Your numbers look great. I'll see you in 6 months." Now, and we need to be really careful here because we are not doctors and this is not medical advice. This does not mean garlic replaces blood pressure medication. If somebody is currently on blood pressure pills, they should absolutely 100% not stop taking them because they watched a YouTube video about garlic. What the research suggests is that garlic works through some of the same mechanisms as certain medications, And for people with mildly elevated blood pressure who aren't yet on medication, it might help bring numbers into a healthier range. But that is a conversation between a patient and their doctor, not a decision to be made based on anything we say. The other thing happening during weeks 2 and 3 is subtler but equally important. The endothelium, that incredibly thin layer of cells lining the inside of every artery in the body, is starting to change. It's becoming slightly healthier. Less inflamed, more flexible, more responsive. The endothelium is kind of the unsung hero of cardiovascular health. When it's healthy, it produces nitric oxide on its own. It resists plaque formation. It regulates blood flow. When it's damaged by years of high blood pressure, high cholesterol, smoking, diabetes, or just plain aging, it becomes dysfunctional. And endothelial dysfunction is now recognized as one of the earliest stages of heart disease, often decades before a heart attack actually happens. Garlic's antioxidant properties begin reducing the oxidative stress that damages endothelial cells. This doesn't happen overnight. It's not like a coat of paint over old walls. It's more like slowly removing corrosion from a pipe. Gradual, steady, but real. What somebody might actually notice during weeks 2 and 3, their blood pressure reading at the pharmacy kiosk is a few points lower than it's been. Maybe they're not as winded walking up the stairs. Maybe they feel a little more energetic in the afternoons. These are the first hints. Subtle, easy to miss, easy to attribute to something else. That something real is shifting inside the cardiovascular system. Weeks 4 through 6, the 1-month mark and beyond. This is when cholesterol enters the picture. And cholesterol is probably the most studied, most debated, and most argued about aspect of garlic and heart health. Here's what the research shows, as objectively as we can present it. A massive meta-analysis published in 2024, covering over 7,000 participants across 108 randomized controlled trials, found that garlic consumption produced significant improvements in triglycerides, total cholesterol, and LDL cholesterol. An earlier analysis of 16 clinical trials involving 952 subjects found that garlic lowered serum cholesterol by 8 to 15% over 1 to 3 months, and a separate study found that eating just 1 clove of raw garlic per day for 16 weeks reduced total cholesterol by 21%. 21% from 1 clove of garlic a day. Let that sit for a second. The mechanism involves garlic inhibiting certain enzymes in the liver that are responsible for cholesterol synthesis. If that sounds familiar, it's because statin drugs, the most widely prescribed medications in the world for cholesterol, work through a conceptually similar pathway. They also target liver enzymes involved in cholesterol production. Garlic does it much more gently, much less potently, and with far fewer side effects. But the direction of the mechanism overlaps. Now, some important honesty, not every study shows these results. Some trials, particularly those using garlic powder supplements rather than fresh garlic or aged garlic extract, found no significant effect on cholesterol at all. The inconsistency in results across studies is something the research community openly acknowledges, and it almost certainly comes down to the type of garlic preparation used. Fresh garlic that's been properly crushed and rested, strong results. Cheap garlic powder pills from the discount supplement aisle, weak or non-existent results. This distinction matters a lot, and we'll come back to it. What people might actually feel around weeks 4 to 6 is honestly hard to pin down, because cholesterol changes don't have direct symptoms. Nobody's ever said, wow, my LDL feels 12% lower today. But there are indirect effects that accumulate. Lower cholesterol means less material available for plaque formation. It combined with the blood pressure reduction from weeks 2 and 3 and the platelet changes from week 1, the entire cardiovascular system is now operating with measurably less friction, less pressure against the artery walls, less sticky stuff floating around looking for places to accumulate, less inflammation driving the whole process forward. Some people report having more energy around this time, better sleep, feeling lighter somehow. Is that specifically the garlic? Or is it the cumulative effect of slightly better blood flow, slightly lower blood pressure, slightly less arterial inflammation, and slightly healthier endothelial function, all compounding on each other? Almost certainly the latter. The body doesn't experience individual biomarker improvements. It experiences the net result of all of them happening simultaneously. And the net result of a month and a half of daily garlic is a cardiovascular system that's working a little less hard to do the same job, which, for somebody over 60, translates to more energy left over for living. Weeks 6 through 12, the 2 to 3 month window. Now, we're into territory that cardiologists and vascular researchers find genuinely exciting, because the changes at this stage go beyond surface-level risk factors. They start touching the actual structure of the cardiovascular system. There's a measurement called pulse wave velocity, PWV, that essentially tells doctors how stiff the arteries are. Healthy arteries are flexible. They expand slightly when blood pulses through them, absorbing the pressure. Stiff arteries don't expand. They transmit the pulse wave rigidly, like banging on a lead pipe instead of a garden hose. Arterial stiffness increases dramatically after about 60. It's considered one of the strongest independent predictors of heart attack, stroke, and cardiovascular death. And for a long time, it was considered essentially irreversible. Once the arteries stiffen, they stay stiff. That was the thinking, but several clinical studies found that aged garlic extract, taken daily for approximately 3 months, produced measurable improvements in pulse wave velocity. The arteries became slightly more flexible, slightly more elastic, or slightly more like they were 5 or 10 years younger. This is genuinely unusual. Most dietary interventions don't touch arterial stiffness. Exercise helps. Some medications help. But food? Finding a food that can partially reverse arterial stiffening is the kind of result that makes researchers sit up in their chairs and want to run bigger studies. Also, during this window, studies have documented reductions in C-reactive protein, CRP, which is a blood marker of systemic inflammation. Chronic low-grade inflammation is now understood to be one of the primary engines driving atherosclerosis. It's not just cholesterol floating around and randomly sticking to artery walls. It's an inflammatory process. The immune system attacking oxidized LDL particles that have lodged in the artery walls, creating a chain reaction of damage, scarring, and plaque buildup. Garlic appears to turn down the dial on that inflammatory process, slowing the progression of plaque. And then there's the study from UCLA that we almost didn't include because it sounds too good. But it's published peer-reviewed research from a major university, so here it is. Researchers found that aged garlic extract reduced the progression of coronary artery calcium, CAC, which is essentially a direct measure of how much hardened plaque is building up in the arteries that supply the heart. Not just slowed it, reduced the rate of progression. Over 12 months, people taking aged garlic extract showed significantly less calcium accumulation than the placebo group. Coronary artery calcium is one of the most reliable predictors of future heart events. A CAC score going up means the disease is advancing. A CAC score going up more slowly means the disease is advancing more slowly. That distinction, over 5 or 10 or 15 years, can be the difference between needing a stent and not needing one. Between having a heart attack at 72 and not having one. From garlic. All right, we need to slow down now and be really honest about the limitations. Because if we only showed you the positive studies, we'd be doing the same thing that supplement companies do when they cherry-pick data, and we don't want to be that. The reality is that garlic research is messy, like genuinely messy. Some studies show dramatic benefits, others show nothing. And the variability isn't random, it follows patterns. Pattern number 1, the type of garlic matters enormously. The most consistent positive results come from 2 forms: fresh raw garlic that was properly crushed and allowed to rest before consumption, and aged garlic extract, which is a specific type of supplement that's made by aging garlic cloves in an alcohol solution for up to 20 months. The aging process converts unstable compounds into more stable, bioavailable ones, particularly a compound called S-allylcysteine, which survives digestion and absorption much better than Allicin does. Garlic powder supplements, the cheap capsules you can buy at any drugstore, have been the least reliable in clinical trials. Several studies using garlic powder found 0 effect on cholesterol, 0 effect on blood pressure, 0 on anything, which makes complete sense when you think about the chemistry. The processing involved in turning garlic into a dry powder destroys most of the active compounds before they ever reach a human body. So, if somebody watches this video and their takeaway is, "I should buy the cheapest garlic supplement at Walmart," they are very likely wasting their money. The research points toward fresh garlic, crushed, rested 10 minutes, consumed with food, or toward quality aged garlic extract supplements from reputable manufacturers. There is a real difference, and it matters. Pattern number 2, the population studied matters. Garlic tends to show the strongest effects in people who already have elevated risk factors: high cholesterol, high blood pressure, existing atherosclerosis. In young, healthy people with perfect numbers, garlic doesn't have much to improve, so the effects are smaller, which makes sense. You can't lower blood pressure that's already normal. For people over 60, who statistically are far more likely to have at least one elevated risk factor, the potential benefit is proportionally greater. Pattern number 3, duration matters. Studies that ran for less than 4 weeks rarely showed significant cholesterol changes. The body takes time to respond. Expecting garlic to lower cholesterol in 2 weeks is like expecting a workout program to build visible muscle in 2 weeks. The biological mechanisms are real, but they operate on biological timescales, not internet attention span timescales. Now, 2 important safety considerations. First, garlic is a blood thinner. We talked about this early in the video as a benefit. Less platelet stickiness means smoother blood flow and lower clotting risk. But for somebody who's already taking blood-thinning medication, warfarin, Eliquis, Xarelto, or even daily aspirin, adding garlic's blood-thinning effect on top could potentially thin the blood too much. That's a real risk. It increases the chance of bruising, prolonged bleeding from minor cuts, and in extreme cases, internal bleeding. Anyone on blood-thinning medication needs to talk to their doctor before adding significant amounts of garlic to their daily routine. This isn't optional. This is a drug-food interaction that doctors take seriously. Second, garlic can cause digestive issues for some people: heartburn, acid reflux, gas, stomach discomfort. Oh, this is especially common when raw garlic is eaten on an empty stomach. If somebody tries the daily garlic thing and their stomach rebels, that's not a character flaw. Garlic contains fructans, which are a type of carbohydrate that some people's digestive systems struggle with. There's a genetic component to this. Some people can eat raw garlic cloves like candy and feel fine. Others get heartburn from garlic bread. If the stomach says no, then no it is. There are other ways to support heart health. Actually, while we're on the topic, let's talk for a second about garlic and the social aspect, because nobody seems to mention this in health videos, but it's real and it affects compliance. Garlic breath, garlic body odor, these are real things. Allicin sulfur compounds are metabolized and excreted through the lungs and skin, which means that eating raw garlic daily will absolutely make a person smell different. And for somebody who lives with a spouse or who has regular social interactions, this can be a genuine deterrent. A few practical solutions that we've come across. 1. Eating garlic with meals rather than on an empty stomach reduces the breath issue significantly because the food helps absorb and dilute the compounds. 2. Aged garlic extract supplements produce far less odor than fresh garlic because the aging process converts the smelly compounds into odorless ones. This is actually one of the main selling points of aged garlic extract. It provides the cardiovascular benefits without the social consequences. 3. Eating fresh parsley after garlic has been shown in some research to reduce garlic breath, because the chlorophyll in parsley binds to the sulfur compounds. Whether it totally eliminates the smell is debatable, but it helps. Look, we're not going to pretend that garlic is a cure-all miracle food that fixes every heart problem. It's not. Heart disease is complicated. It involves genetics, lifestyle, diet as a whole, exercise, stress, sleep, medication, and about 20 other factors that no single food can override. But here's what we can say based on the weight of the evidence. Garlic, specifically fresh crushed garlic that's been rested or quality aged garlic extract, has over 100 clinical trials supporting its cardiovascular benefits. It reduces platelet stickiness within days. It lowers blood pressure within 2 to 3 weeks. It improves cholesterol profiles within 1 to 3 months. It reduces arterial stiffness and inflammatory markers within 3 months. And it may slow the progression of coronary artery plaque accumulation over longer periods. It costs almost nothing. A bulb of garlic at any grocery store is less than $1. It can be added to food that people are already making. It doesn't require a prescription, a gym membership, or an insurance copay. As the ancient Egyptians gave it to the workers who built the pyramids. The Romans fed it to their soldiers before battle. Greek athletes ate it before competing in the original Olympics. Hippocrates, the father of Western medicine, the guy who literally has an oath named after him, prescribed garlic to his patients for a variety of conditions. For 2,500 years, cultures around the world have independently concluded that garlic is medicine. And now, in the 21st century, clinical researchers with access to randomized controlled trials, electron microscopes, and advanced biomarker analysis are basically looking at all that historical data and saying, yeah, those people were right. They didn't know why it worked. They didn't know about allicin or hydrogen sulfide or platelet aggregation or endothelial function, but they knew it worked, and now we know why. So here's the week-by-week summary one more time, just to bring it all together clearly. Week 1, blood platelets become less sticky. Clotting risk decreases slightly, nothing you'd feel. Everything a lab test would show. Weeks 2 to 3, blood pressure begins to drop. Blood vessels relax and widen. endothelial function starts improving. Some people notice slightly more energy, slightly less shortness of breath. Weeks 4 to 6, cholesterol and triglyceride levels shift in a healthier direction. The cumulative effect of all the changes compounds. The cardiovascular system is measurably under less strain. Weeks 6 to 12, arterial stiffness begins to improve. Systemic inflammation decreases. Plaque progression may slow. The deeper structural changes, the ones that take longer to develop, are now underway. Beyond 12 weeks, continued gradual improvement in all of the above. The longer somebody maintains daily garlic consumption, the more the benefits accumulate. 2 cloves, crushed. 10 minutes of rest, added to dinner. Every day, that's it. That's the protocol backed by 100 clinical trials and 25 centuries of human observation. If you found this useful, or even just interesting or surprising, share it with somebody over 60 who you think might benefit. Not because we want views, though we won't lie and pretend we don't, but because genuinely, this is information that most people have never heard presented this way. Most people know garlic is healthy, the same way they know vegetables are good for you. Vaguely, without specifics, without the timeline, without the mechanism, without the context that actually motivates somebody to do something differently. And subscribe if you want more. We put out new content every week for people who've earned the right to get health information that's honest, specific, and actually backed by something. Thanks for watching. Go crush some garlic. And then wait 10 minutes. That part's important.